All right. Do we have somebody who would like to read the land acknowledgement today? Linda is raising her hand. Thank you, Linda. Go for it whenever you're ready.
Good morning. We recognize and acknowledge the indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tenino, Klamath, Molalla, and Yahooskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children.
Thanks, Linda. Real quick, I just want to review. Do we have anybody new or visitors? It doesn't look like it. Am I missing anybody?
Nope, no newer visitors today.
Okay, so our practice is to introduce CAC members and then any guests or new folks. So we'll just go with CAC members. Do you want to help, Kelly?
Yeah, so Brad will start with you and then Elizabeth.
Brad Porterfield, Chair of the Community Advisory Council, Consumer Rep, and Director at Latino Community Association.
Hi, this is Elizabeth Schmidt. I'm the Vice Chair of the CAC, and I'm retired Voc Rehab Counselor. Good morning.
Next, we'll do Teresa and then Connor.
I'm Teresa Lander. I am a community representative in Bend.
Hey everyone, I'm Connor Carlson. I'm a consumer rep in Bend.
Next, Stacy and then Linda.
Hi, I'm a Stacy Shaw, she, her, hers, and I am a consumer rep, and I also work for the Crook County Health Department as a regional overdose prevention coordinator.
Hi, I'm Linda Johnson. I'm a CAC community member and a member of the Health Council as well.
Nice. Then our last two is Karen and then Miranda.
Hi, I'm Karen Correa with Jefferson County Public Health, Health Equity and Education, and a CAC member as well.
Good afternoon, everyone. My name is Miranda Hill. I'm with Klamath County Public Health, and I am the CAC member representation for Klamath County.
Great. We do have somebody that just joined us on the phone. Last four numbers 7309. Could you introduce yourself?
Hi, Kelly. This is Carmen. I'm calling through my phone and
oh, gotcha.
traveling.
You switched up. Hi, Carmen.
Hello.
Thanks for joining us, Carmen. All right, I skipped over meeting practices, but since everybody here has been on our meetings for a long time, I think we can jump over that. But please just everybody participate as much as you'd like to. Feel welcome to speak up. And we'll do our best to call on you if we have lots of silence. So is there any public comment or patient story anybody would like to share? Any of you who are in direct service, public health, who else is in direct service? Stacy, yeah, public health. That's kind of it, and me, I guess. Anybody have anything that's?
I mean, that's a broad question I could always share, but I don't know if you want something specific or Like one of the most current things for us is OHP clients or members and the barriers of getting naloxone or Narcan at the pharmacy and some of the stigma around that. That's generally always a pretty heavy topic. I've had about 5 friends help me who are on OHP go to various pharmacies around the region and just test it out for me. Like just say, hey, I'm here. I would like Narcan. Can I get some? And every experience is the tech doesn't know that they can actually get Narcan there. They have to get the pharmacist. The pharmacist is in the know of the fact that they can prescribe it and grab it there. And OHP covers it, but then there's that piece of the stigma around it. So it's interesting, but that's something I've been working on for about 6 months.
Okay, thanks, Stacy. And just in case anybody doesn't know, Narcan and what was the other one? Naloxone. What those are? What? You just briefly explain what those are.
Sorry, I was cold. So naloxone is the drug that is a opioid antidote, so to say. So it blocks your opioid receptors and reverses an overdose. Narcan is the brand name of naloxone. It's a company that produces the nasal naloxone.
Okay, thanks, Stacy.
Would
Karen,
you,
we
could you expand on the stigma, please, Stacy? You
So
said,
for example, somebody who might have an opioid use disorder, or somebody who's a family member or friend of someone who has an opioid use disorder can go to a pharmacy and pick up Narcan or nasal naloxone in order to have it just in case an overdose occurs. But that also is an option for our older adult population that might be on opioids for pain or other reasons, just in case of an overdose. And so generally, like my friend who's also a tattoo artist went in and she got it, and her appearance looks, I would say she was stigmatized the most because of her tattoos and her colored hair, even though she doesn't use any substances. And she was treated pretty poorly while trying to pick it up. She was given a lot of excuses, a lot of kind of like, just that general negative interaction. And the point of having our pharmacists participate in giving Narcan and naloxone is to lower those barriers for people who need it, especially for the family and friends who don't want to go to a syringe services program because it's not their program, it's not their comfort place. So our pharmacies are really a point of access that's supposed to be low barrier, and with OHP covering the cost of it, which is generally about $115, $112, the thought is there, but we don't have the people who are actually running those counters participating in that same idea of low barrier, saving lives, harm reduction. So some background.
good luck. Wow.
Yeah, thanks for sharing that, Stacy. Karen, go ahead.
Yeah, so I wanted to share with you guys that we were contacted by the Madras High School nurse. Her name is Nurse Kelly, and she was wanting to, partner with us. And there's this group of people, they're called One Sight, and we'll be offering free vision exams, and people will get to go home with glasses that same day of the visit. They have like a special bus that they do the exams there, and they're also making the glasses there. They're going to be at Warm Springs K8 on April 20. Oh, here it is. They were going to be there April 27th. They will be at the Performing Arts Center in Madras, April 28th. And then they will be here with us at Public Health in our new building on the 29th. And we will actually get to open it to the community. We're still trying to work out a few things because as far as we know, they're only going to be able to see maybe 90 community members. And that is And as you guys know, OHP doesn't offer vision services for anybody over the age of 21 unless they're, pregnant or they have other like medical conditions where they, need their glasses. But yeah, so it's been a lot of fun working with Nurse Kelly and the gentleman, his name is Steve Stockton. And I would recommend, if you guys are interested, I could pass off his information so other counties can have the same opportunity. I know they're also partnered with the KCI Institute. And so it's going to be really fun because they'll get to come, people get glasses, and if they need referrals for like other doctors, we're going to work close with some of the optometrists here in Madras too, so they could take on people that need, another checkup or another follow-up. So yeah, it's really exciting because, like I said, OHP, it kind of sucks people don't have that vision benefit, but I know that there's a lot of people in the community that could really use this. So once we get more of the details put together, we're going to start, letting the community know. The one thing is that they have to pre-register themselves, and we will call them to schedule them on the appointment, like on our appointment sheet that we have. The one thing I brought up was, we do have some community members that, there's that language barrier. They're not comfortable using technology, phone, iPad, computer, or, there's more of, I don't know, like the elders, I guess, like they're not tech savvy either. So Dr. Baker mentioned that we have some iPads accessible here and that we can help them pre-register, and then if they're here at the building, we'll obviously, schedule them in that same day. But yeah, we're just gonna try and see how it goes with the community. Hopefully they can pre-register themselves. So when they get here, we don't have to go through all of that stuff. So yeah, it's really exciting. And yeah, I can send out the information to you, Brad, and you can share that to others because I don't think I have everybody's email list down here.
Okay, thanks, Karen. And send it to Michaela. and
Michaela,
Kelly.
yeah. Okay, I will. Yeah, of course. Thank you, guys.
Thank you. All right, well, thanks for sharing, both of you. And I did see, Miranda, you were shaking your head during Stacy's comments, so I'm guessing.
Yeah, I
it's-
also run our overdose prevention program here for Klamath County. So I 100% understand her struggles. I've been in this position for about 3 years, so I've had a lot of conversations with pharmacists and things. And so we've created some different programs outside of the pharmacy to be able to get Narcan. Like we give it out at the health department. We've got little red boxes around all different kinds of community agencies. But yeah, it's a constant struggle. So I feel for you, Stacy.
Thanks. All right, last call for public comments.
I've been reading a couple books on homelessness, and now I'm reading one in Boston where they go around with a van at night, and the doctor speaks to the people under the blankets, tries to get them medical care into a shelter. And the other one I read was Amsterdam, where they require people to go into shelters. And the one that I'm reading is called rough sleepers, and that's an old English term for people who sleep on the street. And there's a model that I was interested, Warm Sweet Home has it on their computer, and it's shelters with an overtop kind of, and there's just enough room in the shelter for a bed. Your pet can be in there. You can be a user of drugs if you're not having possession on the property. And the high school kids in their shop, they built the shelters. Yeah. What? Did someone say something?
You might be hearing, there's some background noise.
Oh, okay.
here with me.
So that's all my comments are. I think that Ben needs to look at some models since they're gonna pay a lot of money out for the homeless. And I think we should use the best models, that we can find. So it's pretty interesting. It's pretty horrible too, but anyway, that's my new interest.
Thanks, Elizabeth. All right, well, let's go ahead and move on. Thanks for all the comments and sharing. Let's move on to looking at our minutes. Everybody have a chance, our notes, sorry. Everybody have a chance to look at our notes from the January 19th meeting. And did you see anything that doesn't accurately reflect what happened at that meeting? Anything needs to be changed or any comments? And if not, if there's no objection to the notes from January 19th meeting, we'll just accept that as your vote, that they accurately reflect what happened. All right. Thanks, everybody. Is there anything, I don't have those up in front of me, but are there any follow-up items in the notes?
There are, and most of them, Kristen's gonna follow up on next month.
Next month, okay. Okay. Yeah, thanks for highlighting those for us. Transportation and dental. All right. Sweet lab. Several items. Okay, great. So that's all gonna be followed up on next month. That's the plan.
Yes.
Okay. All right, so with that, let's move on to our small group breakout sessions.
So today we'd like you to go into your small groups and think about the CAC and any accomplishments or any processes in the last, few years or however long you've been on the CAC. Think about, do you want to change anything? What went well? What could be better? And what do we want to look for in 2023? So it's going to be a little different today. We're going to do 5 minutes in the breakout rooms, and then we'll do about 5 minutes as a whole group all together.
Please plan on having somebody to report back during the second 5 minutes.
Yeah, if one person, at least one person from each group could have somebody that maybe takes notes or is going to be the speaker of the group when they get back. Any questions? All right, we'll see you in about 5 minutes. All right, everyone's back now.
Elizabeth, sorry you got cut off there in our group.
Yeah.
And we also didn't get a chance to see who wanted to report back. Teresa, would you like to do that? Or you feel comfortable doing that since you were kind of guiding us?
I can try and then jump in if I didn't, if I mess it up, which anyway, I'd say the synopsis is, let's see, that the things that irritated us were the slow process, that I think that was across the board, that people were feeling like it's a slow process, that we've moved forward a little bit, but not as fast as we'd like to see. Positives for Brad said that our participation's been up really high, consistently 80-85%. Stacy said she'd like, or that she was learning to be patient because she's learned that anything with the government takes a really long time. I take very bad notes. So other things were that we're not really, well, we're kind of becoming with the emerging issues, more of a little bit of an advocate, and Brad said for OHP clients, and Brad said he'd like to see it kind of go that way. So would I. Elizabeth said she would like to have see more of what we actually accomplish. And she specifically talked about where the grant money went to. So that's like a vague overview for me trying to keep track of anything. Anything else, you guys? Stacy, Elizabeth, did I miss anything?
I think you covered just about everything. I also brought up the emerging issues process that we developed. Feel good about that. And then we didn't actually talk about the community health grants, but Elizabeth did bring that in. So that's enough for our group, I think. Thank you, Teresa. Who's ready? Michaela, go for it.
For processes, are we talking about processes across the board, or CBI just in general, or community health projects just in general?
Are you referring to Elizabeth's comment or Teresa's?
Yeah,
sharing
and
this?
back in the conversation, just to make sure I know, I understand. Was that slow process, like?
Oh, just I think in general, yeah, that's trying to. Maybe I'm wrong, but it's like we're maybe going to many different directions. That's just that there's a time here, time here, time here, and we only meet once a month. So not that I think anyone can add more time to their agenda. But so I think across the board is your answer, I think. Correct me if I'm wrong, people.
I think you're right. I mean, it's just that, yeah, it's like, I mean, take the dental issue, emergent issue of dental care and as the example, because that's the one we started with. And yeah, what progress have we truly seen? Not much. And some of that's because it's a personnel issue. There's not, dentists lack staff. I mean, there's a bunch of issues there. But nonetheless, I don't think we've seen a tangible, either we're not remembering it or we haven't seen a tangible improvement in the dental area. It's been several, I don't know how many months or a year. So anyways, let's, I'm sorry, we got to move on to the other groups to give you your voice. Who else would like to speak up for your group? Looks like Linda, go for it.
Thanks. Our group talked about how much they appreciate the breakout sessions when we meet because they build relationship and knowledge and listening to each other with the information that's shared. They also have felt good about particularly the advocacy role with the dentists and how we are starting to find our voice and speak to specific issues of concern. And there was appreciation for the grants work that we've done this last year, approving the grants and going through that process of expressing the values of CAC and being able to contribute to system reform in that way. And I think in the future, they'd like to continue, we would like to continue exploring a more in-depth relationship with the board so that we can be more effective at advocating for OHP. And the board really hears that and feels that they are well informed as they go through their decisions.
Thanks, Linda. Anything else from members of Linda's group? Briefly. Okay. How many groups do we have? 3? We have one more group.
We did have 3. It was our support members, Pacific Source and OHA. Do you guys have anything to share?
Hey there, this is Dustin. I think I can just chime in a little bit. It's been a couple of us have been, working with CACs for, well, a decade now in some capacity or maybe close to that. So I think, there's lots of changes there. I think in what I've seen personally from an OHA perspective is it's always really hard to find that balance of involvement from CAC, specifically community members, to really make choices around grant funding and grants for projects that align. And then that involvement in the, I guess, just really the decision-making ability, and then really having enough time to feel like you can get reimbursed for that time, or you have like an opportunity to transportation to areas. So it's always just finding that balance is a really difficult thing. So I think continuing to figure that out is going to be helpful on how to make grant decisions for community programs. And I think one thing I'd love to see is report backs from those organizations that get grants on how they're impacting the community, so the CAC can really make a decision on what's working from your opinion in the community, what's a really good program, and what you want to continue to fund. But I know we had other discussions within there, so I'll just let them chime in. Kristen, I know.
I
Thanks,
think
Dustin.
oh,
Go
sorry.
ahead, Kristen. Go ahead.
I think similar, just trying to balance what the OHA wants specific source to also speak with the CAC about, whether it be to get feedback or even just to provide information, and how much time those conversations can take up and take away from the things that you all want to focus on. So kind of echoing what Dustin said, just trying to find that balance. And on my side, working with the OHA Transformation Center to share your feedback that you'd like to be more focused on, advocacy or emerging issues, and not maybe spending as much time being talked at by us about, whatever it is that we think is important to share, because this is your advisory panel, and we want to make it as meaningful as possible for all of you. And I know that Tanya also was speaking right as we were getting pulled out of the room, so maybe she wants to continue her thought here. No pressure.
I think I'm good. Thanks, Kristen.
Tanya, was that you're okay? You're good? Or do you want to share something?
Oh, no, nothing to add. Thanks.
Okay. All right, well, thank you. And the other thing, I don't know if Kristen, if you wouldn't mind, because I know you're like the CCO representative who tends to take the issues that are raised in the CAC and do something with them. So if you wouldn't mind, if you have the time, have the energy to put together a list of all those things. So I think we kind of lose track also, I feel, because there's a lot of those little things, and maybe those little things, are actually little wins, so to speak, that we're just forgetting about because we kind of move on to the next thing and, just sort of lose track. And again, we're only here together once a month, so it's easy to do that.
I'm happy to share some very tangible examples of the impacts the CAC has had with some of our member-facing material updates that have been made.
Okay.
So I can send those to Kelly and Michaela and Gwen, and we can share those out and talk about them if you'd like at a future CAC. But yeah, I'd be happy to share those. Those are some really just visual examples of the feedback that you've provided.
Linda, are you unmuted on purpose?
Yes, I am.
Okay, go ahead.
I'm just wondering if it would be of value for us to know. I mean, we talk about the concerns that we experience in our region. And I wonder if some of the same issues are also being experienced by CCOs in other regions as well. And would that be helpful for us to start to identify system problems as opposed to local problems? Or is it just kind of nice to know, but not really useful?
Okay.
I know I'm new to this meeting today. Hello, everyone. Let me adjust my cameras. Trisha Wilder, the CCO director. My only thoughts in that space are, Linda, is that we are in the marathon phase of our growth here in Central Oregon, and even other Pacific Source CCOs are just learning how to crawl. So they have only been formed within the last couple of years, so that we can be in a really unique place in that we have data over considerable longer times, again, that is specific to our region. So I just would throw that out for consideration that our other CCOs have been doing this. So they really look to us, and I just love how we as lifelong learners also, not to say that there isn't things that we couldn't learn to in those spaces, but as leaders in this space to help guide them in their new processes, we are much, much further along in our journey.
Thanks, Tricia. And Linda, when is that annual Community Advisory Council, whatever it's called, conference or whatever it's called? Is that in June?
I'm thinking it is. I don't think I've seen a notice about it, but I seem to remember it was in June.
Because that could be a good opportunity to kind of follow up on what I heard you recommend. There's a couple, 2 or 3 of us who are willing and able to go to that, you know, go into that and sharing what we're doing at our CAC and hearing what they're doing at their CACs, and, you know, kind of identifying if there's some of that systematic stuff that maybe it makes sense to join forces on or not.
And having been to one virtually during the first year of COVID and listening to your predecessor, Brad, who attended several of them, I think it's a great value for every CAC member if there's a way that you can make it and make the time available to attend those workshops. There's nothing like sitting down and having lunch or sitting next to someone in a presentation and talking about what's the same as or different from what they're experiencing in other parts of the state.
Yeah. Okay. Well, thank you, everybody. We do need to move on to our next item, but I really appreciate that. And hopefully somebody got all those notes. All of the feedback from you. And we'll have that documented. So for now, let's move on to Michaela and our community health projects debrief and planning.
Yes, and before we move on to that, and Linda, you said that you saw some information about the statewide CAC conference in June.
No, I haven't seen anything yet.
Okay.
But I'm wondering if the OHA transformation website might have information about it.
I am looking right now.
Yeah, those are wonderful conferences.
Yeah, I haven't seen that final date yet either, so yeah.
Okay. More information to come, and I'll share that with all the CAC members.
Great.
And then also to follow up on one of the group's conversation around the combined board and CAC meetings and strengthening that relationship and advocacy with the board. Typically the next combined meeting would be in May. And so I was wondering if the CAC would like to host the board members at your May meeting instead of joining the board at their meeting, like it has been these last couple times.
We want to do a 5-finger voting on this. Does everybody remember the 5-finger voting? At least if your camera is on. 5 fingers is you absolutely support that idea, and then it goes down from there. If you get down to a 1, you're basically at a 1, you're saying no way, don't like it, hate it. And then there's like a continuum in between. It's got a 4 from Connor. You can either use the chat or just do this.
Linda says 5, Frank says 5, 4, 5, 4. All right, so we'll invite the board to your May meeting for our next combined meeting with them. Thanks, everyone. All right, it's that time again. We're moving on to community health projects. So today, I was hoping that we could spend some time debriefing the 2022 process, doing a bit overview of community health projects, just because there are some new faces, and it's been a year, I think, since you've seen this information. And then if, as time allows, start considering how you'd like to shape the process for next year, or this year, 2023. So with the brief overview of community health projects, I don't want to spend a lot of time on it because I want to get into the conversation today. But I'm also happy to sit down with anyone and go over it with you individually. And also slow me down if you have any questions. So for community health projects, they are community level projects focused on improving population health and healthcare quality. And they must focus on addressing social determinants of health and equity. And these are components of social determinants of health that ranges anywhere from education to food insecurity to childhood development, basically everything in your surroundings that would impact your health. And what do community projects do? Aside from addressing social determinants of health, they improve health outcomes, reduce health disparities, promote the efficient use of resources. They must align with our 6 priority areas with the Regional Health Improvement Plan. And they're meant to promote increased wellness and health activities and overall community well-being. There are some restrictions for these funds. They can't go towards anything that can be billed to health insurance plan currently. And then we know that there are some changes happening in 2024 that will be excluded as well, which we can talk about that at another time. Rental assistance, housing construction, utilities, projects benefiting a single individual or household. So remember, these are community level projects. Health information technology that may go against Pacific Sources 1 vendor policy. Health council staff or household members can't apply for these funds, and neither can OHA or DHS.
Michaela, can you go back one slide?
Mm-hmm.
Can you go back one more, please?
Yeah.
Oh, maybe, can you go back one more? I guess I was a little confused with the second bullet point on that slide about housing. So here, the 6th one talks about housing, but if you go 3 slides down, it says it can't be used for rental assistance, Can you kind of explain how social determinants of health, we talk about housing and basic amenities here, but on slide 7 or whatever it was, or 6, it says it can't be used for rental assistance and stuff like that. Can you kind of explain maybe how we can look at that or what that means?
Yes, and I'd also like to lean on Kristen and Trisha. But there are, so there's, I don't know, there's ways to address housing that aren't paying for someone's utilities or the actual construction of the buildings. It might be used for programs to help get people housed. There's some other examples, Kristen.
Funds have been used for home improvements. Last year, you guys funded a project through Habitat for Humanity, Sun River and Lapine, and that allowed them to make home repairs so people could stay in their homes. And that would be outside, paying for things outside of what DHS might pay for. So Department of Human Services would need to cover like ramps or grab bars if it was like a disabled person, but this covered beyond that, again, like roofs, things like that. And then there was also a housing, the Cornerstone housing that you guys invested in, which was also providing education programs for people in maybe low-income housing apartment complexes. But basically, when we start paying for individual rent, then it turns into flexible services and would be at like an individual member level. And so Pacific Source would then be the one to receive that request for an individual member and would either agree to pay it or not. So it's anything for like an individual member falls into the funds that Pacific Source administers. Does that make sense?
I think so. I'll marinate on it, but I appreciate the details there. That helps me. Thanks.
Thanks, Kristen. Thanks for the phone a friend. All right, where are we? All right, and then just a reminder, as part of the CCO's contract, that CAC members have to have a role in deciding how these funds are spent. And that's why you're involved, but it also gives you some flexibility in determining that process to invest those funds. And then the CAC members have to make a decision on who you're funding and what you're funding by November 30th, and then those funds have to be allocated by the end of the year. And for this year, expect again around $2 million. Questions? Okay.
Hey, Michaela, I have a quick question.
Yeah.
So that $2 million amount, can you just explain to us all why does that number keep going up? Like we started out with 400 and something thousand, and then last year it got, it went up significantly to, that was $1.9 million or something. And now you're saying 2 million again. Can you just explain why that number's gone up?
Yeah, so part of the community health projects is the community benefit initiative, and that hasn't really gone up much, but the bigger chunk of this is from quality incentive measure funds that have to be used towards social determinants of health. And the reason that we have such a big pool, and Trisha and Kristen also correct me if I'm wrong, but from one meeting, doing a good job providing services and improving the quality of care within this region and meeting those measures. And then two, I think it has something to do with the increased enrollment on OHP in Central Oregon.
Well done, Michaela, first of all. And Brad, part of a side project I'm doing is pulling together all these funding sources since the beginning of time so that we can look back in a single document more historically, whether it's shared services or quality improvement measures or this component of SDOH. So I think your timing of this question is appropriate to some side work that I'm doing that I also have questions. But I think in 2020 that what you're referencing is we only had a 25% payout that year. That's why it was only around 4 million, if you will. And that had to do with the pandemic and the way that dollars were released without needing to meet quality. So that year is a particularly low year. In previous years, you'll see that bounce back up into double-digit millions, if you will. And again, I'd be happy. I hope to have this information soon, maybe even by the next CAC meeting. And then, so last year, looking at that larger payout, this is consistent with a payout at 100% based on our membership. So last year and this year, we're estimating a total payout of $20 million for Central Oregon, and the SDOH component is 10% of that. So that is actual math I can do in my head, which takes us to approximately $2 million. So I hope that's helpful, and I look forward to providing that information for all the groups that work across these funding investment sources.
Oops. All right. Any more questions before we move on? Okay, so now I want to debrief the 2022 process, and with that debriefing conversation, wanting to move into shaping the 2023 process. So I have some questions for you, and if we have time, we'll break out into small groups and do a little bit of small group work. But for the first question for you, just to make sure that we're all on the same page and kind of remembering what happened, what happened? What were some facts? What was the process? And you can unmute yourself or put it in the chat just to kind of get us remembering the 2022 process. So not how you felt about it, but what happened?
Anybody? Anybody?
We had about $2 million. I don't know, I'll start.
I really like the spreadsheet that that you guys put together. It was a great reference sheet for me while I was reading.
So we had a spreadsheet of the proposals.
The summary from Kristen.
We also had a lot of applicants, and then you made it voluntarily able, or you made it a volunteer action to review more than your required 10 or 15, whatever it was. And you paid us.
All right. Within 10 applications, we reimbursed for members' time reviewing. Does anyone remember how long the process took, like month-wise?
It was 2 or 3 months, yeah,
Okay.
2 months. I just remember September, October-ish, August, September, October, somewhere in there.
We also had Buffy reviewing native applications that really helped. Because we got her perspective and she's more educated in that area than most of us, or at least I'll speak for myself, I am.
All right, let's move on to next question.
Yeah. Sorry, Michaela, just real quick, like a key process piece was the LOI, the letter of intent, letter of interest, whatever you want to call it. Step before the full applications, that was another thing.
Yeah, so we used an LOI process. Yeah, we started out with the LOI process, but then shortened it, remember? Because we were going to do one round of screening with letters of interest and then ask them to fill out the full application.
Mhm.
All right, let's move on to the next question. Now that we're kind of primed. All right, now we're talking about how you feel about it. What did you like about it? What were the good parts of it?
This is Miranda. I mean, I really enjoyed reading them just to learn more about the work that's happening, in the communities. I'm in Klamath County, so I don't get to fully understand what's happening in Central Oregon all the time. So, and also like reading it and kind of thinking back, like, oh, maybe these are programs that, other communities can start. So I definitely enjoyed just learning about the work that's happening.
Thank you.
Same. I kind of felt like it was really helpful even for my job here at the county to just learn what is out there and what is possible and the different opportunities in general.
Okay. And I also heard you say the spreadsheet was helpful in the summaries. When we were talking about, is that right, Stacy? A slide back on slide 10.
Yeah, when reading through all of those different applications, being able to have something else in front of me that I could refer to really quickly, just to be like, oh wait, I don't want to scroll all the way back up to the top of the page to see what they checked for involvement.
Okay.
I like the fact that we broke it down into smaller groups so that each group had a fewer number of applications to read. We could read more and we could volunteer for it, but if we were limited on time, being able to break it down into groups was really helpful.
And I appreciated the spreadsheet that was sent along with it, so I could put my notes in and stuff like that.
All right. So what challenges or issues came up during the process? What did you experience?
I guess I'll start. I think for me, and I brought this up with you guys a few months, ago, but how do you manage your personal beliefs with what they're proposing? There might be some things that might be a little different from what you think or believe. And how do you, I guess, judge that, against what they're trying to do for the community? So talking with you guys about that, helped me.
So would it be like personal beliefs or biases?
Yeah, biases would be a great, yeah. How to try to remove those biases as best you can and view it as a project that can really benefit that portion that they're trying to help.
I personally believe you do that by having a scorecard, which we had. So it depends how people actually use it. So I would say have a scorecard and have a consistent process of using it, that everybody's doing the same thing. Then it isn't biased. It's just based on the application, what was required, did they answer it, etc. It's very objective.
One of the challenges I had being a member of a RIP work group separate from the CAG, and the work groups have been doing grants for a couple of years, I found myself sort of losing my way in terms of what's the focus of this grant, what's the source of funding, what are the criteria that need to be made, because when you're reviewing grants from 2 or 3 different groups, I sort of got lost from time to time.
Okay.
I think, correct me if I'm wrong, but did we, I think CAC members asked the staff and you followed up on it to kind of group the applications by issue area, like housing and other issues. Did we do that? Or am I confusing things?
Yeah, we attempted, but it was pretty challenging to do that. just because there are so many different components to the different grants.
Yeah, yeah. But that's one of the things that I would kind of tag along on Linda's comment for me is if you're only doing 10 applications and there's 74, how many other applications are trying to do something similar to the 10 you're reading? And, it is challenging to, but that again, I guess it's where we get back to the scorecard and just trying to be objective, and then we weigh everybody's input.
Mhm. Was the number of grants challenging to review? Like receiving 74, and being able to read through all of them?
Yes. Others, what do other people feel about that?
Yes.
Yes, and I think it's just also the capacity. I know a lot of us, either won different jobs and things. But yeah, there was definitely a lot of grants, and especially if you really want to take the time to really read through them, and give a good fair answer. But also, I mean, I can appreciate that there's this many people to apply as well.
Just briefly, I want to comment on the LOI approach, letter of interest or intent. I'm still not convinced that that's the best approach. And the only reason I say that is because as somebody who writes grants, it feels like the LOI is almost a complete proposal. It's only missing a couple pieces. The budget, like the fully fleshed budget, I think. And I'm not really sure what else. So it seems to me that either the LOI should be even more condensed, so that it doesn't take that much time for the organizations to submit it and us to review it. Or we just have one step with full proposals, and then maybe summaries are created. Yeah, anyways, I just want to put that on the table.
Okay. Are there
Yeah,
other?
oh, sorry, just to tag on to that, just a tiny bit more. One thing I do remember is at least a couple of proposals that I reviewed didn't really say how they were going to spend the money. So I couldn't see a budget, and they didn't say how they were going to spend the money. Like what would they spend that money specifically on? Staffing or something else. And I don't really, it's not to judge how they're going to spend it, but just to know how they're going to spend it is important. Especially with a couple of them. I remember one down in not Crescent. What's the?
Is it Gilchrist?
Yeah, Gilchrist. Thank you. I remember there being one down there that I was like, okay, so how are you going to spend the money?
All right, so we have about 2 minutes left. The next step for this is I wanted to use this list to go into small groups and thinking of things that were challenging, come up with ways to address that and changes to the process that we could. And you as a group don't have to use an LOI process where you all could build it however you'd like to meet your needs. But the intent was to address these challenges that came up for you during this process. Are there anything else to add to this list? And then we'll save this for the next time we come back to it, which would be in a month or two.
Buddy?
So with this list, is there any other
Additional.
challenges or challenges to add to this list to kind of address or look at more closely when we're developing the 2023 process?
I think maybe one more thing I would say is there were some applications that were delayed in getting out to us CAC members to review. And then there was a timeline for us to review those last ones that had to go through either a special review process or whatever that was.
All right.
Michaela, just wanted to do a time check. Did you have more?
So
to
I
go
think,
through?
yep. So I think we'll stop there. And then next time we revisit, we'll break out into small groups and using what you all have shared, kind of brainstorming different ideas of ways to improve this process. So
Okay.
thank you all.
Thank you. Yeah, thanks everybody for your input. Well, our final agenda item is Pacific Source Community Solutions redetermination with Tricia. Got information for us?
I do. I'm going to hopefully share my screen. I'm getting there. I'm getting there. Do you see CAC redetermination up? Yes. All right. One small win at a time. So I won't be able to see the chat while I do the presentation. This is great as a dialogue. So just if you have any questions, I'll try to pause between some slides. This is a lot of information and we don't have all the answers yet. Oh, I see now I'm looking away from my camera. Let me try to correct that here. But we don't have all the information yet, but we do have a lot of information. So I will share what we know and we'll go from there. Let's start with what is redetermination. So this is the continuous eligibility, end of continuous eligibility, and the start of continuous eligibility for kids, if you will. This is named several different things. So sometimes you will hear renewal process. Sometimes you're going to hear unwinding, redetermination, which is just a made up Medicaid word. And as you all likely recall, before the public health emergency, going through redetermination was something that happened on an annual cycle for our members. And let's talk a little bit about how this changed. So in 2020, the Families First Coronavirus Response Act required states to keep Medicaid enrollees continuously enrolled as long as there is a public health emergency. So the intent here was that nobody would not have Medicaid coverage during a worldwide pandemic crisis. Then, as we are unwinding out of this pandemic crisis, Congress passed the Consolidated Appropriations Act, happened right after Christmas last year, which means that continuous eligibility is no longer attached or coupled with the public health emergency. So for many, many months, we've been saying, we're not sure if the public health emergency is going to end, but when it does, it'll affect redeterminations. Those are two now completely separate entities, and we have a date for when this will begin. So redetermination will begin on March 31st is the very last day, meaning April 1st. I don't know if they did this on purpose with April Fools, but it's true that redetermination will begin. States then have 12 months to initiate the process and 14 months to complete the process. So just a little more background. Here's a couple of, and I said I would pause, so I'm just going to pause in the first couple slides and see if there's any questions. And again, I can't see everybody, so just unmute and jump in. Okay, I'm going to send this PowerPoint also out to Michaela, who can then send it to you so you will have all these live links. So there are some community-facing toolkits available, but really I think most important piece of information, if you only remember one thing during this whole presentation, is to help members ensure that they update their contact information. So we've been asking for, I think Leslie says 7 or 8 years for the CCO to have the ability to update our members' address. We were just granted this a handful of months ago. So my recommendation would be that if you're working with somebody who has moved, a member who has moved, perhaps there's someone who moves often, that it would just be great to call our customer service. The hours are listed there in the number, and just confirm what address they have on as their contact information, because this is how OHA is going to connect with all of our members. So really important, our provider partners can't do this. So if you're at an appointment at Mosaic, you can update the address within their system, but in order for it to be updated at OHA, you can either call OHA or you can call Pacific Source. Just a heads up, we measure our wait time in seconds. So I would really recommend calling the Pacific Source and getting a live person to do that. Any questions? All right, well, let's talk a little bit about what this process is. So again, the process eligibility, continuous eligibility will end on April 1st. Everybody will not be redetermined. We'll talk about that in some subsequent slides, all on April 1st. There's nearly 1.5 million people in the state of Oregon, so this will be spread out. You see on the third bullet that we will stage re-enrollment by, OHA will stage by population. So groups that are expected to remain on Medicaid will be redetermined first, and those expected to actually come off Medicaid will be redetermined last. And I'll talk a little bit about why in those spaces as we go forward too. Members typically had less than 90 days to respond when a eligibility application comes from the state. That's been expanded to 90 days. And there's going to be a few points throughout this that I think, being a group that works with OHP and Medicaid, it'll be really important to help people understand that if you do not respond, you could lose your benefits. So it's so important that people take the time and ensure that they're responding within that 90-day window. So this is more of what the timeline looks like. So you see April 23 on the far left, and then May 24 on the far right of those months. So that gets us to 14 months when redetermination will be complete. Again, members front loaded. So the first 3 months will be groups we expect to stay on Medicaid: pregnant moms, people collecting SSI. Then there will be a secondary group that will be spread throughout. There are groups that OHA just needs more information on. And then the backloaded people at the end. So when you look at month 11, 12, 13, 14, as we look into 2024, those will be the groups that, again, they expect to potentially need the new Bridge health plan and are likely higher income earners in this space. So some of that reasoning is because the Bridge program doesn't exist yet. It's being worked on, and we have a member of our Pacific Source team who's in a small committee that is working on legislation for the final details of what this Bridge plan is. But this is essentially to cover members who make 138 to 200% of the federal poverty line And that, sorry about that, if you see that. And the reasoning around that is that is typically called the churn population. So the people who often are on Medicaid, then off Medicaid, on Medicaid, off Medicaid. So we're working hard in the state of Oregon to create another option in that space for people who earn in that 138 to 200 percentile again. Until that is created, everybody who earns 138 to 200% is currently covered until the end of redetermination. So that was an incredible support from our state to move this work forward. Any questions on the process? And I think I cover it a little bit more as we go too. I can't stress enough that while we're going to talk about members in the space, again, this is people and this is our healthcare coverage. So important. You can see if you look on the 130/20 on the corner of the slide, when this began, the pandemic began, we were, somewhere between 1 million and 1.1 million people in Oregon on OHP. And you can see now as of, that's very recent information, just the end of last month, we're looking at nearly 1.5 million people. So that's 500,000 people who are now covered that are likely a result of this continuous eligibility. So a lot of people are affected in this space. It's important to note. We don't actually expect we will drop all the way down to those 2020 numbers. That's unlikely. So sorry, let me move that off as well. But we do expect some numbers, and I'll share those with you as well for Central Oregon specifically. So we began the pandemic, about just over 67,000 members in Central Oregon. We are now, and I'll tell you, as of December, we have tipped over 74,000 members. So that is quite increase in membership. It's about a 40% increase. We actually had the largest increase in membership over the Pacific Source 4 CCOs. So we are expected to potentially drop a little bit more as we've grown more. All CCOs that grew the most are expected to decline the most. Let me show you what we think this means. So right now, we're anticipating January being about 76,000 members. So members continue to be added, and until April, nobody is coming off of Medicaid. So adding. We expect to be at about 77,000 in July. And then we will begin the unwinding or decline as Medicaid members are redetermined that they're no longer eligible for Medicaid. Ultimately, what that could look like at the end of December is about 66,000 members. So that is quite a sum. And then also what I would like to share is that as we look to 2024, so this only gets us to where we think more members will likely come off because of the income constraints starting in 2024. And we'll be working really hard once this process gets started to start estimating 2024 projections, but we don't expect this to really stabilize until 2025. So we will likely have lots of conversations as we learn more in this space and have a better understanding for what the real numbers are here. These are, again, I can't say enough, our best guesses. Anyone have anything? So let's talk about some exciting news that's attached to this. So you may have heard about an 1115 waiver, and that gets thrown around in its connection to this work. So I wanted to look up and really provide a definition of what this is. So the Section 1115 of the Social Security Act gives the Secretary of Health and Human Services authority to approve experimental, pilot, demonstration projects that promote Medicaid objectives. Under this authority, the Secretary can waive, which is why it's called a waiver, certain provisions of Medicaid law. It gives the states flexibility to design and improve their programs. So 2 of these waivers that we are granted, one, and this is just incredible, and we have been fighting for this for an incredibly long time, is that all kids 0 to 6 will have continuous eligibility. Then kids 6 to 19 will have 2-year eligibility. So these are really, really big, exciting wins for our state as a whole. And the last one, we can't say with firm certainty, but we expect this to completely pass the legislative process. And at which point all OHP members over the age of 6 will have 2-year eligibility. So then once anybody is re-enrolled in Medicaid during this process, the soonest they will be redetermined again or have their eligibility checked is 2 years. And if you're a kiddo between 0 and 6, you don't do it again until you're 7. I wish I could get Jerry. Okay. The next 3 slides, I'm going to be really honest, they're relatively new to me in this process. This is fresh information. So I just did an overview slide here, and then I'm going to send it out to y'all to just read them. But there are 3 different ways that a renewal can occur. One's called automated, another's called passive, the last one is called active. It has to do with how much information OHA needs from the individual. So if it's automated, they're going to go straight through. They don't need any additional information. They already know you qualify. Passive, they're going to seek some information, and active, they're going to seek more information. And we can certainly dive into these, I think, more at a subsequent date as we get better at understanding this process internally. Most important thing, again, is to update your contact information, and then just anybody, the second they get any notice, a letter, it is not the letter you want to set aside and deal with later. This is likely just providing additional information that OHA needs to keep you eligible. So it's really, really important to respond. And then just note, no response could result in a loss of coverage. I would even say will likely result in that. So again, next 3 slides, complicated. I talk about the 3 different processes and timelines associated with the automated, passive, and again, the active renewal. Just again, most important factors being be able to be contacted by having updated information, and then just respond as soon as possible. So this is what I was typing. Oh, that was a terrible. I was typing this while Brad was like, let's shift gears. I was like, oh no, so close. So Oregon has an application assistance directory. This is so great. I did it. I thought, do this and see how easy this is. It's really easy. You just put in your zip code, what kind of assistance you're seeking, and it not only pulls up a map of a location, but it gives a list. And I didn't get them all in this list, but our friends in the room at Latino Community Association, I don't know if Mosaic's in the room today, Central Oregon Pediatric Association, Deschutes County, Lapine Community Health. So these are example of just a few. I think there are 4 more I didn't capture in that time frame, but it's great to just go to that link. So if anybody asks you, how do I do this, or who could I talk to for help, these are the places to go. And then there's additional information on how you could become certified to assist. We at Pacific Source cannot do this work, so we have to wait for the process to happen through a third party, if you will, through OHA. Otherwise, it would be considered marketing if we did it. And so we can't solicit for members. So does anyone have any questions there? All right, we're almost done. We're almost done with this really exciting topic. Again, here's just a few more places where you can look for Marketplace Community Partner grantees. And let's just talk a little bit about the Bridge program. So the Bridge program is really established to work within that 138 to 200 percentile. And you see that on the April 1st. So it's expanded in a temporary coverage. Why is it temporary? Because once the Bridge health plan is in place, it will no longer be temporary. So the goal is to work towards, and this has been a common challenge in Medicaid for a really long time. So really exciting that we'll have a place for members to go. It's not Medicaid, it's Medicaid Light. I can't speak to what it is yet because it's still being created at the legislative process. Can't see all my slide on that side. But again, the goal of it being completed by January 2025, which really we're hoping that will be the final work done to then help stabilize the system after all of this continuous enrollment then being disrupted by re-enrollment, which is a normal part of the process that happens. But also now with kiddos being 0 to 6 continuous and adults 7 and up, having 2 years, it's just going to take us a while, and then the system should hopefully normalize, then come back to some sort of stasis where we can are better at predicting things. But I'm happy to come back and share information as we learn it. We don't really think we're going to know that much more until around October, because every time you add in a 90 days for the member to respond back, it's just going to take us a little while to gather that information. But I'd certainly be happy to then. And again, I'll send this deck out. There are my emails there. If there's any one question you didn't want to ask in front of everybody, but you'd rather, just send it to Kristen and I, and we'll be happy to respond. Any questions outside of that?
Trisha, I had a question, and it may not be a good question, but through the redetermination process, is there a place for people that are thrown into an emergency situation that might need some special accommodation, or is it strictly by the numbers? Or I know you guys don't do the redetermination, but from what you know of the process, is there some safety net or some process for people that are thrown into an emergent situation?
I'm meaning, so they would lose coverage potentially and then be in an emergent situation in that space is
right. Say, for example, they're midway through a course of chemotherapy.
Yeah, that's I have heard some on that. I want to double check before I speak to it as a whole in the group, but Linda, that's a great question. I think to ask in this process. So let me come back with what I think is our best guess in this space and send it out. I'll send it out to Michaela, to everybody, because I think that's a really, what do you do when you're transitioning between the two and now you're no longer eligible, and let's say you go to the marketplace, but now how do we bridge that level of care? I just appreciate that patient-centered question. So yeah, good one.
I have a quick, just a quick statement, not necessarily a question, Trisha. This is Carolyn with the Marketplace. And I just wanted to say, I did put it in the chat. We are hosting a webinar on the Marketplace side of the transition on what that would look like. And you guys as CAC and the Health Council are welcome to attend. It's not for public per se, it's more for partners. But it'll talk more about like the unwinding special enrollment period, what those transitions will look like, and notices that folks maybe expect to be receiving. And I put the registration link up in the chat.
Oh my gosh, that's so great. And then Dustin, I realized as I maybe couldn't quite answer that question from Linda too, I'm wondering if you understand how somebody who's perhaps mid-process, say in chemotherapy or something, how that might work in that transition of care like that.
There's some instances, and there's probably some, really depends on the individual situation, but there is kind of that presumptive eligibility component too, when in the hospital where someone might suddenly become eligible or they don't have any insurance. There's that process. Mid change, whether they suddenly would become eligible due to like a loss of job or going through that process. I think those are the individual components that are tough to answer. And you'd still have to go through at least an application, but I think there would probably be some safety net or potentially other programs if OHP is not the right process that might be able to help with those things if they're, because a loss of job wouldn't necessarily just qualify you if that's where your health insurance is coming from, since it is income driven. So
right.
I'd need to do a little more research too.
Yeah, it's such an interesting question, and we're talking about unwinding, but in fact, some members, of course, will be joining as new members as well throughout this process. So balancing both of those needs throughout the next couple of years will be important that we are continuing to work to help people get established with their primary care providers, and not just thinking about the people who are coming off, but also remembering new people coming on too. That was a good reminder for me.
Exactly. And then there is the looking at the bridge program between those that don't qualify for OHP and might fall under the marketplace, but not quite, or somewhere in between. So there's that option too. still working on those. Yeah.
Thank you, Tricia, for that educational presentation. I think it's pretty clear. Good job. And
you.
for all the comments, yeah. We are out of time. Once again, I want to thank everybody who made it, who joined us today. Thanks for being here and contributing. And we'll see you next month, if not in between.
Thanks,
Thanks,
everyone.
everybody.
Bye.
Bye.